A very, very good morning to all our participants once again. And first of all, to all our doctors, a very, very happy Doctors' Day. And as we are already pre-decided on the agenda, that today we will be primarily focusing on the public health system and, of course, with the reference to the Heal in India program that is ongoing by the government. So, without wasting time, we'll start the slides. Yes, we can accommodate people at the time. So, to quickly introduce, India's dual healthcare system, as we all know it, we are all kind of aware. So, this is just a brief introduction about how the public health system in our country is divided into the public and private providers. And also, I would be highlighting the Heal in India initiative as to what the government has in mind and what are the upcoming future perspectives on the healthcare market front. Few questions that have been, you can say, identified or picked up from our previous sessions. What is MVTF? There are a couple of people who are still confused, and of course, not many people are aware of the full form of MVTF. Basically, MVTF stands for Medical Value Travel Facilitator. Basically, it's an agency or you can say company per se, which facilitates a medical visa or which facilitates the incoming of the you can say foreign patient and ensures that the stay and the overall billing and other aspects of insurance and you can say the return are all facilitated properly as per the legal gambit and the protocol requirements. Next, of course, what is digital health? Slightly new topic, but yes, as we are all aware, we are slightly progressing towards digital health. Ever since we had the COVID, we had the Arogya Setu app and so many other things. Like we had certain online tracers, and of course, the government has also ensured that there are many IT related amendments, IT related improvements that have been done. So, what is digital health? How we as private players can gain out of it? And what is the role of accreditation? Of course, what we see now, we have various accreditation bodies because that is what the TPAs and insurances and other empanelments also require. So, what is the role of accreditation in this entire stance? And what is India's position in international health? That is also what we'll be discussing in the course of the webinar. Now, as I said, that India has a three-tier public health system. So, as you can see on the right side of the panel, we can just elaborate our systems in the form of this diagram. So, we have primary healthcare centers, which are basically kind of allocated by blocks of 50,000 population. So, per 50,000 population in our country, we have one primary health care center, PHC. And then, of course, we have a slightly higher referral center, which is also called as the community healthcare centers. And then, of course, we have our district hospitals and medical colleges, which take care of the entire gambit of primary, secondary, and tertiary care. That is the overall, like you can say, in a nutshell, how our public health system is designed. Now, coming to the key challenges as to how you can say are certain bottlenecks affecting our public health system. At the same time, they are also affecting our larger perspective, perhaps the economic perspective of India being a healthcare destination. So, as we all know, that India holds, you can say, geographical differences, and therefore there are aspects where we will find, you can say, hilly areas, and then of course there will be desert areas, and then there will be areas which have more flooding, and of course coastal areas and landlocked and so on, and therefore the differences are very clear and legitimately placed. So the key challenges in public health, as we are already aware, that infrastructure in the rural setup is inadequate as of now also. Of course, there have been, you can say, tremendous improvements, and of course, there are, you can say, number of places where uh, we can visually see or gauge that yes, there have been changes and amendments which have benefited on the infrastructural front. Like we have better roads now, we have better connectivity. But on the healthcare front, still we are struggling because you will still find a government hospital or a PHC or a CHC which is still lacking upgrade. Of course, we are a very large country, no doubt about it, and therefore the improvements are in process. Then, of course, we have a very large shortage of healthcare professionals who are trained. We might have, you can say, people who are experienced, but again, out of experience, they might have learned, they might have had certain process gaps, but then still there is a huge dearth, you can say, shortage of the trained healthcare professionals in our country, and that is a fact. And yes, we are also working on it. Surely, we will be able to address those challenges in our coming times. Of course, these are highlighted challenges which we are already aware of. And yes, the high out-of-pocket expenditure when it comes to healthcare, preferring to the private partners or the private players, we definitely intend to derive quality when we spend on healthcare, and therefore the individual high out-of-pocket expenditure is also a challenge in public health. And when we talk about states, yes, of course, there are states like we have the mountain states or the hilly states. There is uneven access, no doubt. Then we have states which have continuous cyclones or flooding. Again, there are challenges. There are states where literally it is very difficult or inconvenient to, kind of do any civil infrastructural work. So there is an uneven access across states, but still, we can proudly say that our government is working on those challenges. And yes, there are going to be improvements once now that these challenges are identified. Things are definitely on the right path to progress. And as we know, there are certain government reforms and innovations which are already in place. So this is just that we are all brushing up as to what is already in availability. The Ayushman Bharat Yojana, as we all know it, under the gambit of the PMJAY, that is the Pradhan Mantri Jan Arogya Yojana, is already in place, and it's already covering the socio-economically weaker sections of our society, and it is doing a good job in terms of providing a capital health insurance of around 5 lakh rupees per family, which is somewhere covering the major risk elements or the major packages that otherwise would have been unaffordable to the lower socio-economic or income distressed classes. Next, of course, we have the National Digital Health Mission. So this is one very important innovation. National Digital Health Mission talks about something called as ABHA, ABHA. That is basically a Ayushman Bharat health account for every citizen, just like we have our Aadhaar cards and perhaps something which is a duplication of the social security principles. So just like in the West, we have social security numbers, social security cards. In India, we have an Aadhaar card, which actually takes care of our digital identity. Of course, it is just an identity. It is not a citizenship for sure. That is a disclaimer that government itself says. So what NDHM does is basically it provides a bridge between the Aadhaar and a health repository, cloud health repository, which actually ensures that all our health data, particularly pertaining to that particular individual, can be stored and retrieved from one common cloud point. So supposedly I went to multiple doctors and they prescribed me multiple drugs and multiple treatments. And there is one common repository where all this data is getting collected. It becomes easier for each other, like not only clinicians, but also the government from the perspective of, you can say, identifying as to what the current practices in the clinical, you can say, domain are. So National Digital Health Mission is definitely a very interesting and a very reformative innovation because as it is we generate for one single admission of a patient, let's say with a slight critical care area, around easily 50 to 60 papers are a compilation of the file. Once things are digital, we will be definitely saving on the paper part of things. Apart from which, it will be easy for the clinicians to decide to see each other's treatment protocol and a medical reconciliation could be achieved. And definitely now, as we are all aware, we are aware of the term called Ayush. That is, there is a ministry of Ayush, which is the Ayush, which stands for Ayurveda, Yoga, Unani, Siddhi, and homeopathy. So these are alternative treatments which focus on preventive and promotive care, and the government is keen and very focused on taking things ahead. Now, let me introduce Heal in India from the, you can say, layman perspective to all of you. This was a scheme, or you can say a program launched by the Ministry of Health and Family Welfare and Ministry of Ayush. So what happened is that government understood that there is a tremendous potential in our country where we can do something called as Seva with Atiti Devo Bhava. We already have promotion of tourism under the gambit of Atithi Deva Bhava, which is the guest is our god. So we can provide seva as well, and that too at affordable and world-class levels of treatment. So we would like to understand the overall concept of Heal in India as India should be positioned as per the government's initiative is that we should be positioned as a global hub for medical value travel. Now, some key features of Heal in India program. So as we know that digital health is one of the key gambits of the success story for Heal in India. So definitely the initiation has already been on the digital platform since the beginning. So it's basically one app which is available on the App Store. So what happens is that we are supposed to, you can say, if a patient or a beneficiary would like to enroll and see to it that he takes his medical treatment in India. So there is a digital portal per se available, which is a one-stop platform for international patients. Then, of course, the visa procedures are simplified because these are all e-medical visas, and of course, extended stay and allowances from the embassy are, you can say, very smoothly processed under this scheme. Then, of course, the integration has been with Ayush, as I shared with you. Ayush stands for Ayurveda, Yoga, Unani, Siddhi, and Homeopathy. So that India as a destination, as we all know, that we, since beginning, have always instituted bridging modern science with ancient wisdom. So that is our USP, as we can see. So the integration with Ayush ensures that international patients also get a choice to get holistic care offerings throughout their stay. And yes, of course, there is a major collaboration effort on the public-private partnership front because apparently without the effort or without the handholding of the private sector, the public sector will not be able to accommodate such a large-scale program in our country. So yes, there will be requirement for empaneled hospitals, facilitators, and of course participants who will ensure that the program is a success. Now, of course, we need to identify the synergy between public health and Heal in India. As we are already aware, leveraging the public infrastructure for what we call international travel or international care is one of the major challenges that the government is very tremendously working on. And we can see that in our regular day-to-day cycles. We can see that there are a number of aims which are coming up. There are a number of GMCs that are upgrading, which is a very good initiative. And of course, this needs to be leveraged at a fast track level. Then, of course, as we know that public health centers, particularly medical colleges, and of course the tertiary care hospitals, they are getting priority in terms of infrastructural upgrades, which is again one of the synergistic efforts that we are seeing. Another requirement that is being very clearly addressed is that there is a very good and pertinent, you can say, effort from the, you can say, revenue generation angle, particularly when we see that there is reinvestment in our stockholding patterns, as well as there is a reinvestment from the GDP perspective. So, number of areas which public health has been given priority is again, you can say, demonstrative of the fact that there is a synergy between public health and heal in India. Now, opportunities and ways forward, what we now see is that, of course, we still need to strengthen our quality standards. For example, we have NABH, we have various other bodies. We have ISO 7101, which is one of the recent developments that we highly promote because, of course, before 2023, we did not have a standard. So, therefore, saying that NABH or JCI or whichever standard we were, you can say, preferring at that time, it was somewhere very, you can say like it was a gap that we were unable to identify a certain universal standard. So we somewhere used to classify that this is a higher standard or this is a lower standard or this is a local standard, and there were certain names that we used to just funnily out of nowhere we used to comment or commentate without any digital evidence of data. So what we now understand is that, of course, all the standards, like as of now, if we see our Indian healthcare, you can say market or environment, as of now, we have QCI, which of course has NABH. We have QAI, which is again a body which has certain empanelments and insurances which are preferred. Then we also have ISO 7101. As of now, yes, we have few bodies who are, you can say, promoting ISO 7101. But if we see from the healthcare angle, and of course, when we talk about laboratories, we have ISO 15189, which is again under the NABL gambit. So, what we normally understand is that accreditation just lays out certain standards from the international domain, international good practices. It could be either ILAC, it could be ISHKIWA, it could be any body which actually, you can say, specifies certain good practices. And there are committees which are way, way ahead in terms of competence, in terms of experience, in terms of market exposure. These committees are like, you can say, like highly empowered with the level of knowledge, with the level of domain expertise that they bring on the table. So these committees constitute and they ensure that certain aspects pertaining to our Indian perspective are matched, are met, and therefore these standards are finalized, printed, and then you can say provided to the hospitals for further implementation. Now, if the standards itself are diluted, or perhaps the understanding is diluted in terms of implementation, definitely there will be a lack when we talk about international level of care delivery. So it is pertinent, it is understood that we have to be very specific and very aligned when we strictly adhere to quality standards and accreditation. Secondly, we need to train healthcare professionals for global competence. We need to have upcoming, you can say, trainings. It could be on job trainings as well, but then healthcare institutions will have to, you can say, put a very clear policy to only hire and retain professionals who can be competitive globally and could demonstrate competence and at the same time professionalism. So then only we can confidently say that yes, we are able to achieve what we have set out to achieve. Of course, promoting ethical medical tourism is one of the key agendas in this overall access of healthcare. And one important aspect that we are still, you can say, trying to address is that digital health interoperability. It is a very big question, still a major challenge. We need to enhance it at priority. So as we can see now, we have certain standards. I'm not very sure, but on our LinkedIn feeds and other news, social media interactions, what we find that digital health is being very pertinently promoted. And rightly, it is the need of the hour because unless our digital health infrastructure is not strengthened, it will be very difficult for us to progress or make any strides in the Heal in India program. So please understand that thing. The other aspect is that, as you can see, the bold statement that I would like to put across in our webinar today, please try to understand accreditation is not a medal. It is a milestone in your journey of quality. So it will be slightly hard to, you can say, certain doctors and other people who are participants today, particularly hospital and lab owners. Please try to understand that accreditation is not a medal. It is just a milestone because this is a continuous journey. And what we understand that we, from the consulting angle or from the, you can say, auditing angle, when we see to the fact that, the hospital or the lab has become stagnant after getting the certificate, it's a little, you can say, hurting to the heart kind of statement. But then this is a continuous activity. It needs discipline, it needs effort, and accreditation is something that needs to be maintained, not just a milestone or something. Yes, we achieved it and now we are through. So that should be the attitude and the approach for all of us today. Conclusion, yes, we are very sure and confident to say that India's public health system is evolving. And we are, as of now, like we all know that we are the pharmacy to the world. We supply 60% plus vaccines and medicines to the world, particularly to the South-South collaboration and other SAARC nations. So we are definitely evolving to meet domestic and global needs. And yes, in the terms of health diplomacy and economic growth, health is one key parameter, and Heal in India program will be a definite game changer, specifically when we talk in the context of 2023, the G8 summit that we G20 summit that we had recently, in which one health program was very specifically highlighted. And of course, digital health is the way forward. It is high time that we consider digital health. We move towards quality standards in digital health. We adopt digital health in our regular clinical practices. And we emphasize to our patients also to go digital through ABHA or through whatever means possible, which the healthcare institutions and establishments feel ideal. But yes, digital health is the way forward. There is no looking back. So, with that, once again, I would wish all our doctors and all our participants a very happy Doctors' Day. And we open the chat box for questions now. If there are any questions, please share. We'll be more than happy to answer it today. Thank you so much.